Victory. Oops. No.
Why we care. Why euthanasia should be legalized. I want to ask you a question. Picture a loved one of yours was dying of lung cancer. With each and every breath they took, their bodies cringed with unbearable pain. There was nothing left for the doctors or nurses to do, and no drugs that would magically make all the pain go away. They were left to endure the pain and endure the suffering. Now let's say that this loved one begged you to help them end their pain and suffering. What would you do? If you helped them, you'd probably wind up in jail for murder. What they had just asked you to do is called euthanasia. Euthanasia is a Greek term meaning good death. Euthanasia, which is also referred to as mercy killing, is defined as hastening or putting to death painlessly or allowing the death of a person suffering from an incurable, especially painful, disease or condition. Euthanasia is easily one of the hottest topics in today's society, and everyone seems to have a different opinion on the subject depending on culture, national laws, and their own personal beliefs. There are a large number of people who believe that euthanasia should never be legalized. Yet in other countries like Belgium and the Netherlands, it has been legal for years and they seem to have no issue with it, and haven't had the uprising those opposing the legislation would expect. Oregon, also since 1994, has had a law allowing for such measures legalized. I want to touch on a few important issues that come along with fighting the legislation for euthanasia. Last year, Medicare spent $55 billion for doctors and hospital bills for patients' last 2 months of lives. That's more than the budget for the Department of Homeland Security and the Department of Education combined. And it has been estimated that 20 to 30% of those medical expenses may have had no meaningful impact whatsoever. Now you may think to yourself, 20 to 30% isn't a huge number, but let me put that in dollars for you. We're talking about 11 to $16.5 billion of what amounts to waste. You could have burned that money and at least kept people warm. This country is in the middle of a huge healthcare debate where millions of Americans are going without any healthcare whatsoever, and primarily because they just can't afford it. If euthanasia was legalized and people had the right to terminate life at the end, and as a nation and on a realistic level we understood that we cannot live forever, imagine how useful that $55 billion would be to those who truly can't afford doctor visits. Talking more about end-of-life care, I've personally worked in a few intensive care units and witnessed firsthand the end times for some of those patients, and frankly it's a horrifying and heartbreaking thing to witness. Patients on ventilators and sedation, with their wrists and feet bound to the bed in an effort to keep them from ripping those tubes out of their bodies. Who we all know have zero chance of ever recovering, yet they are not given the ability to just die in peace. We mechanically keep them alive until even the mechanical process fails or their bodies just start shutting down internally and in a painful manner. The unfortunate thing is, we as a people have a notion that, again, we will live forever. It is our selfishness and naivety that we hang on this belief that it will all just magically go away no matter what the issue is. Unfortunately, this is not the case. Now let's discuss those patients who wish to die, but know that no one legally can help them do it. There is no one that can help them ease the pain and suffering, so it's left in their hands to either suffer through it until they wind up in the hospital or die painfully in their own beds. What if these patients get in their heads that they will not go out that way? What if they decide they're going to just kill themselves with, let's say, a gun? How many times have we read in the news someone tried to kill themselves with a shotgun in the mouth and failed, only to be left disfigured and traumatized for the rest of their existence? Not to mention the emotional toll on whoever finds the loved one in that position. So why would we deny someone the ability to end their life in a safe and secure location, or even at bedside in the comfort of their own homes? Those against euthanasia cite mainly their concerns of abusing the system, stating it would give healthcare professionals too much power and ease to end someone's life. I can understand that concern, but I would have to counter with, how would that abuse be any different than alcohol abuse, narcotic drug prescription abuse, parents' right to not vaccinate their children against known diseases? And I could go on and on. Fact of the matter is, without oversight, then anything can and probably will be abused. But if something like this has had the proper and necessary documentation, oversight, and guidance, why wouldn't it be a better alternative to most of the inhumane practices? And yes, I call them inhumane practices because forcing mechanical ventilation and mechanical tube feedings is not life and is not right. I strongly believe that euthanasia should be legalized. It is our body, it is our mind. Who is the government to tell us that what we can and cannot do with it? We are here. Who are we to force such prolonged pain and suffering on another individual because of our own personal beliefs? I'd like to end with two of my favorite quotes on the subject. From Dr. Jack Kevorkian, aka Dr. Death. In quixotically trying to conquer death, doctors all too frequently do no good for their patients' ease, but at the same time they do harm instead by prolonging or even magnifying patients' disease. And then Milan Kundera says, dogs do not have many advantages over people, but one of them is extremely important. Euthanasia is not forbidden by law in their case. Animals have the right to die a merciful death. Thank you very much. Just go ahead and get them. And then yourself.